Well, at the Baptist Orthopedic Clinic, we feel we're set apart in reconstructive surgery of the hip and knee with use of the MAKO Robotics Surgery technique, in which we do a preoperative CT scan or X-ray of the patient's hip or knee and can plan for the bone cuts that are made before we ever go to the operating room. Use of the MAKO robotic technique has really changed the way that I do hip and knee replacement surgery. For the hip, it allows very precise orientation of the components, the cup of the hip replacement, and also accurate reestablishment of the length of the leg. So those are very, very important, and really has revolutionized my ability to accurately place the pieces and restore anatomy in the hip. For the knee, it's made a huge difference as well in balancing the ligaments in a knee. In the traditional technique of knee replacement, you kind of make the ligament cuts for everybody the same and then deal with the ligaments later. The robotic technique allows you to kind of individualize the bone cuts to balance the ligaments for each and every patient individually, and just results in a more balanced and natural feeling knee, and I've been very pleased and impressed with the way it works. We have here a total knee replacement and total hip replacement model. In hip replacement, we used a robot to specifically size for the diameter of the acetabular or cup component, and just as importantly, for the orientation of this cup as far as its flexion and extension relative to the pelvis. So appropriate orientation for this cup is very important. The striker knee that is used in the robotic process allows through a constant radius throughout the arc of motion, which is unique to the striker knee that we use in the robotic process. Following knee replacement with the robotic process, it balances the ligaments better, which allows maybe for you to get your motion back faster, which makes you get your strength back faster, which results in a speedier recovery, has been my experience with the patients that I've dealt with the robotic knee.